feel like nobody else, nobody else.
About that when I was changing it.
All right, we are talking about sneakers on the break anyways.
No, these are Nikes. I don't want to show my Nikes.
Well, welcome back to Let's Talk Words. So I was telling Dr. Ozello earlier that we are a casual talk show. We are talking to the whole world.
Awesome.
Yes, and also, of course, Dr. Ozello is actually a blogger at YouTube anyways, right?
Yes, I have my own YouTube show. Like I said, it's called Doctor
Ozello, yes.
Yes. Well, I have my own channel, Dr. Donald A. Ozello, DC, and I have 2 shows, 2 Minutes of Anatomy and Dr. Ozello Sports Medicine Report.
So what our viewers expect on your shows?
The first show is just like the title says, it is a 2-minute anatomy lesson where I pick a body part and I speak about, say if it's a muscle, I'll speak about the origin, the insertion, the concentric action, and the innervation of that muscle. Basically what it does, where it's located at. The second show is much more in depth. It is Dr. Ozello Sports Medicine Report where I choose either one condition or I choose an exercise or just something that is health and fitness or sports medicine related, and I go over that topic. Videos can be anywhere from 6 minutes long. My longest one is like 24 minutes or so. Maybe, I think it's 27 to be honest with you. But I talk about a condition, I go in depth about the actual symptoms of that condition, the anatomy that's involved with it, the contributing factors, how someone can prevent that condition, how they can recover from that condition, the professional care, and also the self-care, the patient education, which is so important.
So let's talk about that. Talk about this condition of bones.
Yes.
I used to go to school 3 years ago.
Okay.
I graduated 3 years ago.
Congratulations.
Thank you. And I do a lot of schooling online. That's what I did.
Okay.
So I do a lot of typing.
Yes.
I can type my accurate words per hour would be about 75 to 80.
Wow.
But with inaccuracy is about 120.
Okay.
Yeah, those double word.
That's impressive.
Yeah, thank you. And now I do a lot of work on my computer because of our shows, at social media shows, and I felt that my hand.
Yes.
This is what they call it. They call something. I forgot what they call it, but I felt my uneasiness of my bones on my hand. And I know that they treat that by doing an operation, and I'm so freaking scared on that.
It all depends on
think?
what condition that you're talking about. Okay. There are several different conditions that can be causing your symptoms.
Yes.
Okay. One of them I had actually mentioned earlier. I said thoracic outlet syndrome. There's another one called carpal tunnel syndrome, and there's another one, depending on where your symptoms are at, it is called either cubital tunnel syndrome or ulnar neuropathy at the elbow. And you do not need surgery for those conditions. Those are conditions I treat in my office.
You do?
All the time, definitely. And many times when someone has those conditions, they also have something going on in the cervical spine, or there may be an impingement on that nerve.
You're making me scared now.
As it comes down to the extremity. So there can be an impingement not only in one spot. Like you think of carpal tunnel syndrome, obviously there's impingement right down here at the carpal tunnel.
It's actually here.
That's for the median nerve. Well, there can be impingement in several different areas, but the median nerve begins all the way up in here. And the nerve roots that form the median nerve, they come back here, and the network of nerves that the median nerve comes from, is right down in here. So there can be impingement along the entire course of that nerve. So what I would do, obviously, you do the consultation, you do the examination, you try to pinpoint exactly what is going on. And I would look at the entire area from the lower part of the neck, from basically the entire neck, the upper part of the thoracic spine, the shoulder, the entire shoulder complex, the upper extremity, the elbow, the wrist, and the hand. And then you figure out what exactly needs to be fixed, where those impingements are at. I would do the chiropractic adjustment to restore the proper skeletal motion. I would do stretching exercises. I would teach the person stretching exercises. I would teach the person strengthening exercises. Because many conditions, like you had mentioned carpal tunnel syndrome, or you think that it may be carpal tunnel syndrome. What do we do with carpal tunnel syndrome?
Oh.
We're doing this all day long, right?
Yeah, yes.
Even if you're in good position, okay, we're always using this part of the hand.
Mm-hmm.
So there's strength imbalance that can occur because the back part of the hand is being used. So if someone has that condition, I would check the strength of the front of the hand and the front of the wrist compared to the back of the hand, what we call in medical terminology the posterior forearm or the posterior hand. I would check the strength because they may need strengthening exercises where they are extending and splaying the fingers. And so that is one thing that can be done. Also, nerve slide exercises can be done. Nerve slide exercises are non-resistant, non-exertion exercises that help that nerve to move in between the muscles like it should.
So how's the exercise?
There's several different ones. It all depends.
What I do all the time is I try to put my hands upwards because it's actually relaxed it.
Yes.
Yeah, that's how I do it.
Okay.
And
you have very flexible fingers and hands the way you move backwards. Show everybody.
But anyways, yeah, well, that makes a lot of sense of what you're talking about because what I see is I believe whatever symptoms I'm feeling, it goes all the way up over here, and I think it's affecting the part of half of my body.
It definitely can. Yes.
And
whenever, let me interrupt you for a second. Whenever one area is not functioning properly, another area has to have a greater workload, and there can be an injury in that area. That's why I spoke about overuse injuries when I was speaking about the book. Right? There's some type of biomechanical fault, and that biomechanical fault may be in the foot, but it can cause pain in the shin, or it can cause symptoms in the knee or in the thigh. So that's what the consultation and the examination are for.
That makes sense. Well, I have another question about that. My dad passed away in 2006.
Okay. I'm sorry to hear that.
2016.
Okay.
Thank you. But anyways, he died because of it's not MS, but he died of cancer.
Okay.
Yeah. And probably before he died, about 6 months before he passed away, he felt like all his hand is really in pain, kind of thing.
Okay.
I don't know if it's causes with the cancer, but I felt like I felt the same way because I feel my hands are like I need to do exercise with my hand all the time.
Yes.
To feel cured or healed or whatever you call it. Yeah. Yeah. So, do you think that's actually something to do with your joints over here on your shoulder?
That can be one of the reasons. Yes. Yes. Whenever there are any type of symptoms where it's numbness, tingling, burning, sharp shooting shock-like pain, those are what are called radicular symptoms, meaning that there is some type of impingement on a nerve.
Oh, okay. And then you treat those.
Yes, I do. Yes.
Okay. So what what other treatment do you do in your office?
Well, some of the conditions that I see, like I spoke about, neck pain, headaches, mid-back pain, low back pain, shoulder symptoms I see all the time. You think about when we have athletes, throwing athletes.
Oh yes,
right?
football.
Football, baseball, all types of sports where you have to throw. And when we speak about baseball, you speak about shoulder conditions and what's called the oblique strain. Those are two very common injuries. Also injuries where we speak about any type of runners, any type of athlete that runs, doesn't matter if they're a football player, basketball player, anyone who runs, track and field athletes, people who run on the track, people who are trail runners, all that. There are so many conditions that they can get. Like I mentioned, if there's a biomechanical fault in the foot, that can lead to symptoms such as shin splints. That can lead to knee symptoms. That could lead to iliotibial band syndrome, low back pain. So you have to do as a doctor of chiropractic, I will do an assessment on the entire body. We have to look at the entire chain, what we call the kinetic chain. We can't just go, oh, your symptoms are right here. Oh, I think you need surgery right here. No, you don't do that. You look at the entire chain, how everything works.
And I'm so scared with surgery. So
well,
I should
come and you want to try the most conservative treatment that you can try at first. And then if that doesn't work, then you try something that is more invasive. Okay, but you don't want to just jump into doing the most invasive procedure that you can. You want to try the most conservative thing. Because I have had people come into my office. I had mentioned baseball players. This was a long time ago. I had a young man come into my office, and he was a pitcher. So he was constantly throwing. And he had been a pitcher since he was in Little League Baseball. And he was told that he needed exploratory rotator cuff surgery. Okay. Now, so basically they were saying, we don't even have the exact diagnosis for you, but we're gonna give you surgery, right? And I did an examination on him, and his muscle right down here, the muscle in the front part of the rotator cuff, it's called the subscapularis. It was so tight he could barely bring his arm back like this. Oh. So the first time I worked on him, pressure was like this much, and he was like, "Oh, doc, that's way too much. That's way too much." But after a while, it started to loosen up, and he was able to get full function back into his shoulder, and he was able to get back to playing. Now, I haven't talked to him in over 10 or 15 years, so I don't know how he did, okay, if he was able to make it into he wanted to try out for the minor leagues. So I don't know if he was able to do that, but he was able to go back to the team that he was playing for and was able to pitch again.
Thanks, God. I don't know about that.
Well, I was the one doing the treatment, so.
Yeah, well, you are actually, God is using you to make the treatment. I don't know who you believe, but I'm so sorry.
No, I understand that. Yes. And whatever someone believes, I think that that's what they should believe, okay? But what I am saying, the reason I said that is because he came into the office for treatment, and he did all of his exercises. He asked a ton of questions. He was an incredibly good patient, so I knew that he was determined to get better. And I did everything I could to help him achieve his goals. So he was the patient, I was the doctor, and we worked extremely hard together. We communicated very well, and he gave me as much information as he could, and I gave him as much information that I could to help him achieve his goals.
That's
so
amazing.
When you said thank God, I said thank me and thank him, but I didn't get to finish that part because we worked together as a team.
Well, doctor, I would like to know if you do you take, as a chiropractor, do you take like a medical insurance to actually see you, or?
I am a doctor of chiropractic. I will treat people of all ages. Like I said, both genders, if they are athletes, if they are non-athletes, if they want to come in for a musculoskeletal condition. Do you want to try and say that? Musculoskeletal condition? You can do it.
Musculoskeletal condition.
Awesome. You got
it. Yay! Woo! Thank you.
She practiced during the break, so that's why I knew that she could do it.
No, I didn't.
I wouldn't put you on the spot if I knew that you.
So you didn't answer my question.
Yes, I'm getting to that point.
Okay.
Yes. At this time, I do not take any type of medical insurance. There are chiropractors that do, but I do not take medical insurance at this time.
So, can you tell us how much you charge? The way if they want to come and see you.
The first visit is $80. A standard office visit is $40. That's not
bad. That's not bad. See, if you're not, if you guys need to be your bones aligned, or anything about chiropractor can do about Dr. Ozello's treatment, go and see him at where?
Yes, my office is called Championship Chiropractic. It is located in Las Vegas, Nevada. I am on West Flamingo, in between Durango and El Capitan. Like I said, I've been at that location about 4.5 years or so. You could contact me at 702-286-9040 or by email at DRO, as in Dr. O, at championshipchiropractic.com. I am also, I had mentioned YouTube. I am also on the web at championshipchiropractic.com. If you go there, you could connect with me on several social media platforms.
Yes, or you can actually message us at social media or info@socialmediashows.com, and we'll take you there.
Awesome.
Yeah, we'll take you there.
That.
Why not,
yes.
right? Well, I think we're now ending our last segment.
Awesome.
And we're gonna come back next week, and I hope to get you back again once again.
Okay, thank you.
Probably in 3 months or maybe 4 months. I don't know. He's so busy.
Unless you guys want me to come back sooner, please let Maria know if you want me to come back
yes,
sooner.
we can actually talk about other things.
We will schedule sooner. Yes.
Yes.
All
Yes.
right, well, thank you very much.
Thank you so much, Doctor.
You're welcome.
Pseudoscience. No, just kidding. I'm trying to stir the pot. That's how Maria is.
Okay.
Well, anyways, guys, thank you. I hope you guys learned something with Dr. Ozello here. If you guys know more about, what he does, you can go on your website.
Just championshipchiropractic.com.
Yes, or you can go to our social media pages, and we're gonna have this segment or episode running again and again. So thank you so much, viewers. Make sure you guys be safe every single day. Food Fest is coming up. Go and eat a lot of food out there, all right? And be safe. Take care of yourself. Thank you, and have a good night.
Thank you, everybody.